ethical principle in caregiving is autonomy. Autonomy means people are free to make their own decisions. Example, patient autonomy is crucial because it enhances patient satisfactions, improves health outcomes, and promotes trust and communication between patient and healthcare provider.
Idea that key decisions about a person's life should, if possible, be made by that person, rather than anyone else. The decision of whether a competent adult will receive palliative care, rather than so-called heroic measures when battling a fatal disease, should be made by the patient, not by someone else.
Beneficence. Beneficence means do good when working with the clients. An example of this is responding to the clients in a timely manner or honoring deadlines or exploring all possible options for the client.
It includes the argument that we as a society should arrange for doctors to treat patients with serious illnesses, even if these patients cannot afford treatment.
One of the ethical principles in caregiving is veracity. Veracity means is being truthful and genuine with clients. Examples are the following. First, disclosing all relevant information about the situations to the client. Second, answering questions truthfully. Third, providing realistic and honest guidance.
Hi, Miss Jefferson. What's wrong?
I'm dying.
You're dying? Well, why do you say you're dying?
Because I'm in stage 4 breast cancer. I'm just dying. It's not getting any better.
You're stage 4 breast cancer? Oh, you'll be fine. Don't worry about it.
You sure?
I'm 100% sure. Everybody bounce back from it. You'll be okay.
Okay.
All right, don't worry about it.
Non-maleficent. Non-maleficent is the ethical principle in caregiving, meaning not to do wrong, avoid causing harm to clients. In common language, it can be considered negligent if you impose a careless or unreasonable harm upon another. Example, don't keep giving a client medication that has proven to be harmful. Another example, avoid acting with malice toward the client, not ignoring the client's thank you.
For example, a drug might have side effects that are so severe that they are worse than the condition we are trying to treat. We also need to consider routine causes of harm in medicine. Taking blood for blood tests causes harm in the form of pain and possible infection, as does performing surgery, even though these things might bring us closer to a diagnosis or ultimately curing our patients. We have to clinically rationalize every single intervention we make to keep patient safety and comfort our #1 priority, rather than ordering every test under the sun and hoping for the best.
Right, I'll be sharing ethical principle over caregiving. One of them is justice. Justice asserts that all persons or patients should receive equal treatment. A patient has rights to sign a consent form, to be aware of risks and benefits. Privacy. A patient's information must be kept confidential. Refuse. A patient has right to refuse treatment according to she or he feels. Equal treatment, regardless religion, race, gender, background. All patients must receive equal treatment.
Principle of justice. Justice dictates that all people deserve to be treated equally and fairly. When it comes to medical research, it means all patients and their informed consent should be considered equal.
Fidelity. Fidelity means prioritizing the patient well-being and best interest above all else. For example, a doctor might advocate for a patient-prepared treatment option even if it is not the most convenient for the healthcare system.
911, what's your emergency?
Module 2, M3, Part of Health Assessment.
What is euthanasia? Euthanasia refers to deliberately ending someone's life, usually to eliminate suffering and pain. The word euthanasia itself comes from the Greek word eu, good, and thanatos, death. The first countries to legalize euthanasia were the Netherlands in 2001 and Belgium in 2002. Types of euthanasia. Active euthanasia. Killing a patient by active means, for example, injecting a patient with a little dose of a drug. Passive euthanasia. Intentionally letting a patient die by withholding or limiting artificial life support, such as ventilator or feeding tube, so that a person passes more quickly. Voluntary euthanasia with the consent of the patient. And involuntary euthanasia without the consent of the patient, for example, if the patient is unconscious. Which country have legalized euthanasia? Switzerland, Netherlands, Spain, Belgium, Luxembourg, Canada, Colombia, Australia, and New Zealand.
Advance Directive.
Written instructions that let people know the kind of care you want if you are seriously ill or dying are called advance directives. These are official documents that state your wishes for medical care in an emergency and at the end of life. These include a healthcare power of attorney, a living will, and a DNR, or do not resuscitate order.
Healthcare powers of attorney, often called durable powers of attorney, are again an advanced care directive. They're legal documents that express your wishes, but also designate a specific person who will speak for you if you are not able to speak for yourself. The living will is really a document that details what kind of care you want to receive. And it would be used in a situation where you are not able to speak for yourself. A do not resuscitate order is a physician's order. It is based on your request and information to your physician. That order is placed in your medical record in the hospital. And it basically tells providers when you don't want life-saving treatments to continue.
The time to plan for your long-term care needs is before you actually need them.
If you're in good health, that is absolutely the best time to begin thinking about long-term care. It's when you have the most options available to you. It's when you have time to actually think about and plan, talk with your family, decide what you want to do. I think about it as akin to planning for retirement. The earlier and the more planning you do for retirement, the better your retirement will probably be. So I think it's the same thing with long-term care.
2, M3, Part of Health Assessment and Vital Signs Taking.
Hello, good morning.
Good morning.
I'm Shirlita from NACA. I'm here today to measure your blood pressure.
Okay.
May I know your name?
Yes.
What is your name?
Mary.
May I ask some question from you?
Yes.
What is your usual blood pressure?
120/80.
Did you do exercise 15 minutes to 30 minutes ago?
No.
Did you drink some coffee or tea today?
No.
Did you drink alcoholic or smoke today?
No.
Did you take any medication today?
No.
Did you have surgery before?
No.
Which arm do you refer?
Right.
Okay, sit properly. Don't cross your legs. Keep your feet on the floor. Now I'm going to take your blood pressure. Your blood pressure result 124/80. Thank you very much.
Thank you.
Okay, so the first pulse point we're going to talk about is the temporal pulse. The temporal pulse can be felt in two spots, primarily in front of the tragus, right here, just anterior and slightly superior to the tragus. You're going to use two fingers to palpate the pulses. And that's the point right there, just in front of and slightly above the tragus of the ear. And this is it on this side. Now sometimes you will see people palpating the temporal pulse up here, and this is the anterior branch of the temporal artery, and so you can feel it in this location as well. It's not quite as strong. And that is the temporal pulse point. Pulse point we're going to cover is the carotid pulse. The carotid artery can be felt in the neck, right where I have the stickers located. There is the trachea in the middle, and there is a neck muscle that runs along here. And right in the middle of that, where the sticker is located here, is where you're going to find the carotid pulse. So you're going to use two fingers. The carotid pulse is a very strong pulse. It's the pulse that's checked during code blues to see if a patient has a heartbeat, and so it's a very reliable pulse to palpate. Make sure you only check for the carotid pulse on one side at a time. This is because if you check on both sides at the same time, this can occlude blood flow to the brain. Also, you don't need to press hard on this artery. It's a very strong pulse, and you don't want to stimulate the vagus nerve, which could slow down the heart. Okay, so next is the apical pulse. It is fifth intercostal space mid-clavicular line, or the point of maximal impulse. To assess the apical pulse, it is best to use your stethoscope. However, you can feel it as well if you lay flat and just apply your hand. As I mentioned in my last video, women usually have breast tissue covering the apical pulse location, which is also over the mitral valve. And so on women, you're going to lift up the breast tissue and listen right beneath. On your patients, make sure you apply your stethoscope right to the skin. So the apical pulse is a very reliable pulse. It is best for assessing a pulse most accurately and for detecting. The next pulse is the brachial artery pulse. This is where I can palpate the brachial pulse on my arms. You may have to move up slightly or slightly down to find it on your arm. So it's at the antecubital fossa, just medial, and you can apply two fingers and feel the pulse. The brachial pulse is the most reliable pulse to check during a pediatric code blue. The pulse we're going to talk about is the radial pulse. It is found on the thumb side of the wrist, so that's where I could palpate the radial pulse on myself. The radial pulse is located on the thumb side of the anterior wrist. So the radial pulse is a very quick and easy pulse to assess. If you're just trying to count a patient's heart rate, the radial pulse is the most frequently used pulse point to assess the heart rate. So to check the radial pulse, you're going to take two fingers and hold it right over that pulse point. If this is your first time checking the patient's pulse, you're going to want to palpate for 30 seconds and multiply it by 2. If the heart rate feels irregular, count it for 1 full minute. And if it feels irregular, check an apical pulse. You're also assessing the force of the pulse. 2+ is normal, 3+ is bounding, 1 is thready or weak, and 0 is absent. So you want to feel a normal 2+ pulse. A normal heart rate on an adult is between 60 and 100 beats per minute at rest. The next pulse point is the femoral pulse. I'm just going to show you the location here through my shorts. So again, you'll want to assess right on the patient's skin, but for the purpose of this video, I'm doing it through my shorts. To assess the femoral pulse, you're going to press into the groin, slightly medial. And I can feel it quite strong on myself, but on some patients you have to press more firmly to be able to palpate the femoral pulse. So the femoral pulse is really important to assess for circulation in the legs. It's a very large and strong artery. So the popliteal pulse is found behind the knee, and it is felt with deep palpation. I'll just show you the location behind my knees. So the popliteal pulse is quite deep, and it's always been the most difficult pulse. So the way to find the popliteal pulse is to reach behind the knee with both hands, and there is a diamond-shaped pit in the middle, which is called the popliteal fossa, and you're going to press into the center of that area to locate the pulse. And then the posterior tibial pulse can be found just posterior to the medial malleolus, and you will feel the pulse right there. And you want the foot to be in a nice relaxed position to be able to feel this pulse.
I'm going to do the dorsalis pedis pulse.
Module 3, Part B.
Surface temperature.
In the adult, it can vary anywhere between 97 degrees to 99 degrees Fahrenheit, with the average about 98.6. In a child, it can also vary anywhere between 97.4 to around 100 degrees Fahrenheit. And anything greater than 100.4 is considered a fever in both the adult and child.
Core temperature is the temperature of the body's internal. A normal body temperature ranges between 36.5 and 37.4 Celsius, but temperature readings vary depending on where it is measured. Core body temperature refers to the temperature of the body's internal organs such as the heart, liver, brain, and blood. On the other hand, surface temperature is the measured on the surface on the skin and is affected by external and internal factors such as ambient temperature.
Taking axillary temperature.
When taking auxiliary temperature, make sure the armpit is dry. Put the tip of the thermometer in the armpit. Close the armpit holding the elbow against your chest. Do this for several seconds until you hear the beep. If the temperature is above 99 degrees Fahrenheit or 37.4 degrees Celsius, your patient have a fever.
The average normal oral temperature is 98.6 Fahrenheit or 37 degrees Celsius. 0.3 Celsius or 0.5 Fahrenheit to 0.6 degrees Celsius or 1 Fahrenheit lower than oral temperature. The oral temperature is measured with the probe placed under the tongue and lips closed around the instrument. This can be used for children who are older than 5 years of age.
Rectal temperature.
Rectal thermometry is taking a person's temperature by inserting a thermometer into the rectum via the anus and considered the most accurate way to take body temperature. Rectal temperature is the most accurate way to take body temperature, but some may consider it to be an invasive or humiliating procedure. Body temperature is most often 0.5 Fahrenheit or 0.3 degrees Celsius, a convenient way to take a child's temperature. Axillary temperature compared to rectal temperature and oral temperature is not as accurate in reading body temperature.
My presentation today is about vital signs. What are vital signs? Pulse, body temperature, blood pressure, respiratory rate, and oxygen saturation. What are the importance of vital signs? Vital signs helps us to detect or monitor the medical problem. It helps medical professionals to check the overall health of their clients. It can be done at home or elsewhere if you have proper medical equipment.
Taking temperature, pulse, and respiratory rate.
And then next step is to prepare the materials needed before assessing the vital signs. First is the auxiliary route. 1. Provide privacy. Assist the client to comfortable position, then clean the thermometer using cotton balls and turn it on. Next, raise client's arms, insert the thermometer into center of axilla, and lower arm properly across chest. Then leave the thermometer for 1 to 2 minutes until you hear beeping sound. And then, while waiting, you can get the patient's radial pulse. Remove the thermometer and read the temperature displayed in digital window. Then, disinfect from stem to bulb using a cotton ball with alcohol, air dry and turned off, and put it back on its container for next use. And then, don't forget to document your findings. Third is monitoring respiration. First, keep fingers on the client's wrists, and then place the arm across the chest. Using a watch with the second hand, count the number of respirations for 30 seconds, and multiply this number by 2 to calculate the respiratory rate per minute. If respirations are abnormal in any way, count the respirations for at least 1 full minute. Note the depth and rhythm of the respirations. A complete cycle of inspiration and expiration constitute 1 act of respiration. And then document your findings.
Module 5 Nutrition.
Nutrition physiology is an area of study that deals with the relationship between nutrients and how the human body functions. It is a vital branch of physiology that focuses on the biological and biochemical processes that occur in our bodies, including the absorption, digestion, and utilization of food.
6 types of nutrients. 1. Carbohydrates provide the primary, especially for the brain and muscles. 2. Proteins, essential for building and repairing tissues and supporting immune function. 3. Fats, healthy fats like omega-3 and omega-6 support cells function. 4. Vitamins, vital for various body processes, including immune support, bone healthy, and energy production. 5. Minerals, important for fluid balance and nerve production. 6. Water, essential for hydration, temperature regulation, and digestion.
Importance of minerals. Minerals help maintain acid-base balance to keep the body pH neutral. Also help regulate body processes such as in enzyme systems and help release energy from food. Functions of minerals. Number 1, maintaining strong bones and teeth skeletal system. Number 2, the synthesis of hormones and enzymes. Number 3, muscles functional including the heart. Number 4, brain and nervous system functioning. Number 5, immune functional organs and cells. Water makes up 45 to 75% of our bodies and is important for good health. Water is used in different body processes and helps to regulate our temperature. Blood and other body fluids are mostly water, which helps to carry nutrients around the body and in and out of cells.
The amount of water we need each day can vary depending on age, activity, and level.